Hello to everybody in Maryland's beautiful 8th Congressional District. It's Jamie Raskin coming at you this Friday for my favorite time of the week, Local Heroes, where we profile and get to interact with the people who make the 8th Congressional District such a remarkable place. And here, completing our observation of Hispanic Heritage Month, I've got my friend Diego Uriburu, who is the founder, I think it's back in 1998, of the great local community nonprofit called Identity. And Identity was set up to address the waves of young immigrants coming from Latin America, fleeing violence, instability, gangs, authoritarianism, poverty, and so on. And Diego, who is a mental health specialist, a psychotherapist, recognized all of the social and educational and personal issues that this population had to deal with, and set up Identity in order to address it. And Identity has been a major force within our community on a whole bunch of things. But let me start with this. Diego, congratulations on being our local hero. We're so proud of you. And I wonder if you would take a second just to discuss how you had the insight to create Identity.
Thank you so much, Jamie. It's an honor and a pleasure being with you. And thank you for the recognition. It was not my vision. It was the needs of the community that drove us to creating Identity. We saw a community that for many was invisible, had tremendous needs, but most important, tremendous potential that just needed a little bit of support and nourishment in order to flourish. And that's how we created Identity 23 years ago. Now we are 104 employees. Last year, we served 13,000 Montgomery County residents, many in your district. And we are extremely proud of what we do. Everything that we do is based on the positive youth development model that sees these young people and families as assets that need to be nourished, not as problems to be fixed. And evaluation is a cornerstone. Research and evaluation are cornerstones of what we do. So we do a lot of needs assessments to inform our programming, but also to share information with elected officials to change policies, etc.
Yeah, I mean, it's had such an extraordinary impact. And I wonder if you would just reflect for 1 second about going from being somebody who was a psychotherapist, a counselor for individual patients in different community groups, to being someone making social change and impact on a much broader canvas, and to what extent your prior work has informed the work that you do through Identity.
Well, being a therapist and also was a business major way back, I think everything we study and everything we do informs what we do today. No? It's impossible not to remember and apply the lessons learned. The biggest difference is that one of the frustrations of being a therapist was that you would do excellent work and help one person at a time, one family at a time. But the systemic issues that our community was facing, very few people were addressing at the time. So it is moving from the individual to the system, because the impact is enormous. The Latino community in Montgomery County, now it's close to 21%. Again, these are young people and families with tremendous skills and potential, but sometimes they need a little push more than others because of where we start. But the county has been blessed by what this community has given them. So playing a part of that fills us with a lot of pride.
Well, let's talk about the effectiveness of that kind of collective action with respect to the COVID-19 crisis. I know that you were one of the lead actors with some other local groups, including CASA, as well as County Executive Mark Elrich and the County Council, in trying to go right into the Latino community to promote COVID-19 public health measures, vaccine and testing and so on. And it turned out to be a tremendous success. I mean, I think that the Hispanic community is above the general population in terms of vaccination and so on. How did this come about, and what were the ingredients of the success?
It came about because the county recognized that what it was doing to curb the rate of infection among Latinos that got to 70+% wasn't working. And that's a great skill to have, or awareness, to recognize what you're doing is not working and to reach out to those who know the community the best to help you with the solutions. So we work with the HHS, with the county council, with the county executive, and 5 other nonprofits to develop what's called Salud y Bienestar. And basically, we began to provide a culturally competent response to the need. Rather than wanting people to go get tested at HHS, we went into the neighborhoods, into the zip codes that were most affected. We went in the evenings when we knew folks would have time to get tested. We went during the weekends. With vaccination, we addressed their fears in a communications campaign that addresses all the myths and misinformation. We offered wraparound services that like case management, that help them access health services, access them rental assistance, because all those are risk factors that continued to isolate the community and put it more at risk. So all that yielded tremendous results, as you said. I think that the Latino community in Montgomery County has one of the highest rates of vaccination within the Latino community in the nation, and it's higher than the general population in Montgomery County. So that has been a huge recognition from the county that things were not working, and bringing partners together to jointly develop a strategy that actually works.
Do you have policies or strategies in place to deal with the new wave of unaccompanied minors that we've been seeing coming into Maryland and other parts of the country?
Yes, we are expecting thousands of immigrant and asylum-seeking children, youth, and families come to the county. We think that the Office of Refugee and Resettlement, I think they said there's already 1,000 of those, 1,000 plus that has come to the country. We are following the same model as with Bienestar. We are not waiting for the crisis to get big. The county council, the county executive, and the nonprofit sector got together immediately and said, okay, what strategies are going to put in place to be able to receive these families and young people? So we're working with 30, 40 nonprofits, county offices, and I think that we are going to be in a good place to receive these families. I tell you, at Identity, we've seen, as of 2 weeks ago, we had 620 of these. The majority were families, not just youth who came alone, as in prior years. And they come here with already with illnesses, with COVID or pregnancies. So, and the county is receiving them because it recognizes that what we provide to these young people and families at the beginning would yield tremendous benefits in the short term, but also the long term in terms of benefiting the county's economic infrastructure. So we have seen these young people and families from other waves that came here with very little, but with tremendous dreams, and many of them make their dreams come true. And when you look at the small business creation in Montgomery County, you see many of these families that arrived here 10, 15 years ago now booming with their business, their entrepreneurship, passion, hard work, dedication, etc.
Well, Diego, let me ask you finally about the coalitional work that you've done in Identity. I know it's been important to you, not just to serve this core population, but also to try to uplift the general social relationships that we have in Montgomery County. And I wonder if you would talk about that, and specifically about the Black-Brown Coalition that you have worked on.
Yes, of course. So historically, the Black and Brown populations did not get along. We would compete for crumbs while the cake and the bread and the muffins were somewhere else. And we decided that it was best to work together to advocate for a more equitable educational system. It's the Black and Brown Coalition for Educational Equity and Excellence. And it's a joint partnership that started with the NAACP and identity, and now it has many members. And we are trying to change the equation of power in the school system, where our communities now being the majority, combined, we make up 54% of MCPS's student body, but we had little representation, a little say in terms of policies, in terms of engagement, in terms of budgets, etc. And the school system has been very receptive to incorporating the voices of Black and Brown in key decision-making processes. We're now part of the budget process. We are working with the superintendent of creating maybe a task force to push the school system to improve the way it incorporates the voices of Black and Brown in every decision-making that they do. One of the biggest challenges that we have is the school system spends billions of dollars, no, but millions of dollars in strategies and activities that in the majority of cases do not reach port. So because they do not include the lived experiences of those whom they want to reach in their planning and implementation process. So that's some of the things we want to change. And there are many other inequities that are happening that I could talk about in another program, a longer one.
Well, Diego, I want to thank you for helping to make our community stronger every day, making our society better all of the time, and for demonstrating so much vision and so much effective commitment and passion in your career. So for all these reasons, you're our local hero, and we salute you for all of your work and your success.
Thank you so much for you and for the viewers. You are my hero every day. I'm the hero of thousands and thousands of others. So thank you for everything you do. It's an honor to have you as a congressman.
I appreciate that, Diego. All best to you.
Thank you so much. Muchas gracias.